Tomorrow I take my written local anesthesia board exam. So what better way to review it than to talk about it? I'm a dental hygiene student, let's talk about it. So to start off, we have several different types of local anesthetics. Specifically in the United States is what the ones I'm going to be talking about. We have lidocaine, articaine, bupivacaine, mepivacaine, prilocaine, and those are vasodilators. Anesthetics are vasodilators. Then you have the vasoconstrictors, which are going to be epinephrine and levonorepinephrine. I think I'm saying that right. Some things to know about the vasoconstrictors, epinephrine and levo. They contain sodium bisulfite. And a lot of the times, people are allergic to the preservative, the bisulfate. So when people say they're allergic to epinephrine, that's incorrect because our body naturally makes epinephrine. It is the bisulfite. Because people who have sulfa allergies are going to be allergic to the sulfa. The most common type of people who are allergic to sulfite or sulfa are people with asthma. People with asthma also might have allergic reactions with aspirin, and fun fact about aspirin comes from willow trees. When you use a vasoconstrictor, there are some contradictions that you have to be wary of. Depending on the type of patient, if you have a cardiac patient or a pregnant patient, you have to use a cardiac dose, which is 0.04 milligrams. That's if you're using epinephrine. Now, levo, that's when you use a 0.2 milligrams because it's a little less. Levo is also synthetic. Epinephrine is natural, but levo is a synthetic vasoconstrictor. Normal dose for epinephrine is going to be 0.2 milligrams. For a normal healthy dose for levo, it's going to be 1.0 milligrams. These numbers are very important when you're calculating an MRD, which is maximum recommended dose. It's the maximum amount of local anesthetic that you can give somebody. Back to the contradictions for the vasoconstrictors. You have to be careful with people who have cardiac issues, people who are pregnant, people who have allergies, people who have hyperthyroidism that's not controlled, any impaired liver or kidney functions, hemophilia, and methenglobinemia. You also have to be wary about types of medications that a patient is taking when you give them the local anesthetic. If they smoke anything, if they are taking any cocaine, if they are taking beta blockers, and if they're taking antidepressants, tricycling antidepressants. And lastly, Chymotidine as well. That's like a heartburn antihistamine. Okay, but what is a vasoconstrictor? Why do we use them? So the mnemonic I have for it is it's to slay. It's for safety, longevity, effectiveness, and homeostasis. Slay. So for safety, it basically reduces the rate at which it enters your circulation, so it slows it down. And it helps make the duration of the local anesthetic longer, so it slows it down and makes it last longer. Effectiveness goes along with longevity basically, so it makes sure it slows down, acts long, and is absorbed correctly. Homeostasis, it helps with the bleeding process, so that way they don't bleed as long. Homeostasis, it controls the bleeding, so I'm telling you to stay home. Stay. The anesthetics to use for a pregnant lady are going to be lidocaine and prilocaine. You want to make sure that you use a cardiac dose, what is the cardiac dose? 0.04 milligrams, good job. If someone is an alcoholic, you don't want anything to be metabolized in the liver for local anesthetics. Articaine, which is also called septicaine, is an amide and an ester. Amides are in the liver, esters are in the blood. I had a mnemonic for it for amides, alcoholic, liver, Easter, ester, blood of Christ, and that's how I would remember how they were metabolized. The alcoholics you'd want to use articaine because it's only metabolized 5 to 10% in the liver, and the rest is absorbed in the blood. It's a hybrid of an amide and an ester. All amides are absorbed in the liver, so the safest one to use for an alcoholic is going to be articaine, which is also septicaine. Also, don't use prilocaine or articaine for methenglobomania or sickle cell anemia patients, or if they're taking acetaminophen for those patients. We're gonna stop here, and I'm gonna make another video going more in depth about local anesthetics, but today was kind of more like vasoconstrictors and who to use them on and what not to use. Hope you learned something and have fun studying.